When we're in the seated position, in order to accentuate and really focus in on the scalenes, when I had you supine, I had you sitting on the ipsilateral hand or arm. Another way to do it, actually, let's move to a stool. And let's put the stool kind of right here. Let me have a seat right here. And I'm going to have you reach down with your right arm and grab the bottom of the stool. Nope, like the stool.
Oh,
and just grab it a little bit. There you go.
Oh, I see.
So if your patient needs to stretch this at home, you could have them do it in the shower. Obviously, they can't do it on a stool in the shower. But if they're in the shower and they've got the water beating down, let the arm hang on the ipsilateral side that you're trying to stretch. Okay, so you got the weight of the shoulder, and just think of trying to drop that shoulder down before you do the stretching. But if the person has someone at home that's going to help them stretch, or if you have a patient, maybe they have some sort of vertigo and they can't lay down on the table to stretch, so you're going to put them in the chair or in a stool. Have them grab the seat. They could sit in their hand too, but it's better if they grab the seat. And then we're going to take out all of the tissue tension along this lateral line by just having them lean away. Just kind of lean this way, but hold on to that seat. Now I've taken everything out along this lateral line. So now when I do middle scalene, I'm going to stay in the neutral plane, and I'm just going to push straight lateral. And I'm barely putting pressure on this, and he can feel it right down through there. Scalenes are tiny little muscles, all right? Anterior scalene, we're going to go slight lateral flexion like with the middle, but then, yep, good, take out that lateral line. I'm going to go into a little bit of extension, okay? Then I'm going to turn the chin towards that side and stretch. That's anterior scalene. And for the posterior scalene, come back to neutral. I start out with, I have them stretch out that lateral line, middle scalene, and then for the anterior, or the posterior, slight flexion forward, all right? And now you're going to turn the head away.
Yep.
Like that. And you can feel that.
Oh, yeah.
And Sean will be able to feel middle, anterior, posterior. If I really want to get into some of these trigger points, like in the seated position, I will palpate down. There's like an area in front of trap, kind of behind SCM, in front of trap, and there's like a little hole right here that you can get down into. And I will laterally flex towards to take the tissue tension out to get my fingers down in there. Bring them back to a neutral position. Take a deep breath for me. There. I can feel the first rib come up into the finger pad. And then I can fish around and kind of find these tiny little fibers that shoot straight up, close to the spine. Those are the scalene fibers. And you can actually go a little bit back and find the posterior, go a little bit towards the middle and find the middle fibers, and then just in front, find the anterior fibers. So if I was doing like a trigger point type therapy on the scalenes, let's say they have a brachial plexus C5, C6 radic, and it's irritated at the scalenes, I can start doing these stretches, take out that lateral line, middle scalene, I feel a little bit more in the anterior, I'm going to do a little bit of extension, and then I'm going to turn the chin towards, and you can see by the grimace on his face, because I can see your classmates almost feeling your pain. And I'm not putting a lot of force into this. This is very gentle. All right? So you can do a lot of therapy right there. So I'd like you to take a moment and just try to do the seated version of what we did supine, and see if you can remember to always take out that lateral line. That'll help you do so much more work. And this is true for any concept or any muscle you do in the body. Take the tissue tension out, then work on it, and it'll be much better. You'll have a much better result. Okay? Cool. You're very welcome.